On behalf of the Danzak and Hollister brands, welcome to this World Ostomy Day virtual panel. My name is Tarek Alam, and I'm a clinical affairs manager based in Canada. I have experience as a wound, ostomy, and continence nurse at the McGill University Health Centre in Montreal, Quebec. It is my honor to moderate today's panel discussion with our guests. Each of our guests have their own ostomy journey and are here to share with us how they are living life and bringing awareness to the global community. Let's meet our panelists. Gill Castle has a colostomy as a result of injuries she sustained during the birth of her child. She shares her story on social media of taking part in triathlons and other endurance activities, skydiving, scuba diving, and open water swimming. Gill aims to be the first ever ostomate to complete the English Channel swim. She's a passionate advocate for ostomates, believing that everyone can be active, happy, and live a fulfilling life with a stoma.
Thank you.
Matt Clark has been a devoted player with the Blackheath Rugby Club for the last 19 seasons. Having stoma surgery 5 years ago helped him manage his Crohn's disease, and he's not stopped him from working and leading an active life, playing rugby and cricket, traveling and work. He speaks candidly about his experiences on social media.
Thank you, Tarek.
Tina Aswani Omprakash is a health advocate for patients living with inflammatory bowel diseases and an ostomy. Through her writing, social media presence, and public speaking engagements, she spearheads public health causes, including those creating awareness for IBD, life-saving ostomy surgery, and initiatives supporting global women's and minorities' health. She is presently working on her Master's of Public Health at the Icahn School of Medicine at Mount Sinai. Tina lives in New York with her husband, Anand. Dr. Paul Wischmeyer is a critical care, perioperative, and nutrition physician who serves as a professor with tenure of anesthesiology and surgery at Duke University School of Medicine in Durham, North Carolina. He also serves as the Associate Vice Chair for Clinical Research in the Department of Anesthesiology and Director of the Nutrition Team at Duke Hospital. His career work is focused on helping patients prepare and recover from surgery, including ostomy and IBD surgery, and from other illnesses. He is also living with an ostomy.
Thanks, Tarek. It's great to be here.
Well, welcome, all of you. There are many people across the world living with a stoma. And one of the interesting things about the ostomy community is that there are different paths to how people come into it. Some of the many reasons people may have this often life-saving surgery include cancer such as colorectal or bladder cancer, inflammatory bowel disease such as Crohn's disease or ulcerative colitis, or for emergent reasons such as trauma. I'd like to ask each of our panelists to briefly share a bit more about their journeys, how they came to have ostomy surgery, and what life has been like on the other side. Matt, let's begin with you. Please tell us about your ostomy journey.
No problems, Tarek. So I don't know where my ostomy journey started, actually. I've got two sort of points where it might have started. The first one's when I was very young. A story that goes around my family is that I was in primary school and my parents were at a parents' evening with the teacher who said, "Matt's a very lovely and bright boy, but he has very interesting bowels." And that continued for a very long time. And all that meant was I went to the toilet more than everyone else, and I would pass wind a lot more than anyone else, with some very funny consequences at the time. That continued for a long time, and then I hit my late teens, early 20s, and things really started going downhill. So I was going to the toilet 20 or 30 times a day. There was blood and mucus involved in it. I was throwing up every single morning when I got up. I couldn't eat breakfast because it would just come straight back out of me. And for a long time, I didn't do anything about it. I always blamed it on something that I'd eaten the day before. It must be that I haven't cooked the food properly and things like that. Until eventually, Mum had been going on at me quite a lot, telling me how much weight I had lost and I needed to go and get checked out. But I was at university studying acting at the time, and a friend of mine, I said to him some of the stuff that was happening. I said, when you have a bad bit of food and this happens, and he was like, "No, dude, that's not normal. You need to get yourself checked out." And that was sort of a reality check for me, and did make me go to the GP to find out what was actually going on. My inflammatory markers were really low. They said it was that of someone who had a cold. But anyway, she took a holistic approach about what was going on and sent me for tests at the hospital. Not nice tests, not nice at all, but we got to an end result. They worked out that I have Crohn's disease. From that point, I was tried on all sorts of different drugs. I was on the steroids, biologic drugs, and that just continued for the next 4 years until finally I'd had enough. I went to the doctor because I had a perianal fistula. He said that we have to do surgery on this pretty much straight away. It's emergency. But I had also decided that I wanted a stoma at that point. I said, "Cut me," used that exact phrase, "cut me. I've had enough, let's get on with this." So they did an emergency elective surgery within the month to put in a loose seton stitch and also give me a temporary ileostomy. Surgery seemed to go fine until a couple of days later. I wasn't being able to eat any food. Everything was coming back up. I was throwing up everything that went down, which wasn't very nice at all. Eventually, they did an MRI scan and realized that the opening through which the stoma came out wasn't wide enough. Because of years of playing sport, I've got quite a strong core, and the surgeon just hadn't taken this factor into account. So he came to me and he said, "I messed up. I'm really sorry. Let's fix this." And I said to him, "Don't worry about it. It's not your fault." To which he said, No, it is my fault, and I'm going to fix it for you." That afternoon, I was taken down for surgery, and life's not been the same since. It's been so much better having that surgery. The second surgery changed my life for the better. So that's kind of my journey, really.
Thanks so much, Matt, for sharing. Tina, let's go to you next. Please also tell us about your ostomy journey.
Thank you so much, Tarek, and thank you, Matt, for sharing your story. I definitely feel your pain as a fellow inflammatory bowel disease patient. I myself have Crohn's disease for the last nearly 16 years, and I've had a permanent ileostomy for nearly a decade now. My journey started with me actually being diagnosed with a sister disease called ulcerative colitis. This was, of course, a misdiagnosis. I actually went in proactively to my primary care physician saying I would like a colonoscopy, even though I wasn't having symptoms, because colorectal cancer and Crohn's disease run in my family. My father passed away when I was 8.5 years old. So that's how they found mild ulcerative colitis localized to the colon and rectum. It didn't present like Crohn's disease at the time. It didn't have the typical granulomas or skipped lesions, and there was no penetrating disease such as fistulizing or stricturing disease. So for about 5 years, I was labeled as a UC patient. During that time, I received a temporary ileostomy and went ahead with J-pouch surgery, which is customary for ulcerative colitis patients. I was very sick at the time. I went from 135 pounds down to about 85 pounds in the US metric system. I believe that's down to 37 kgs, and I'm 5 feet 6 inches. So you can imagine how malnourished I was, and I was being fed by tubes. And I had multiple complications with my surgeries, and actually needed 4-stage surgery instead of a 3-stage J-pouch surgery. Before even the takedown, meaning before even my J-pouch was active and my ileostomy was completely reversed, I already had pouchitis, which was inflammation of the J-pouch. That actually turned out to be chronic and refractory and was labeled as Crohn's disease a few years later. What happened is I developed several rectovaginal fistulas over the next 6 years. I was on courses of antibiotics, put on biologics again, and even had my J pouch diverted and had an ileostomy created temporarily again. When nothing worked, I continued to fistulize. I was told that I needed to have the J pouch removed. And that's where things got very tricky in late 2014. My J pouch excision was not done correctly. There were bits and pieces of J pouch and rectum still left inside. I needed to have a few re-excisions done at Cleveland Clinic and Mayo Clinic, and had to have a wound vac placed. And then they found yet another fistula. So I don't know how, but they placed me in a clinical trial, and that was the first time I tasted remission in 10 years. I am still on that medication. It is FDA approved. Between that medication and my ileostomy, those two have saved my life and given me my life back, and I couldn't be more grateful today.
Thank you, Tina, for sharing your story. Gill, you came to have your stoma through a different set of experiences. Can you please share more about your story?
Hi, Tarek. Yes, thank you, Tina and Matt, for sharing your stories. Yours are certainly different to mine because yours is a much longer process to getting your stoma. Because mine was a complete shock. I'm one of the people who has a stoma without even knowing what one was before it was fitted. So if we go back to 2011, I was 32 and I was a serving police officer in England, working out on the beat. I fell pregnant earlier that year, had a really easy, healthy pregnancy, didn't have any problems at all. I was still out walking and being really active up until the day that I gave birth to my baby. Unfortunately, I went into spontaneous premature labour 6 weeks before my due date, and that was on October the 20th, 2011. Because my baby was 6 weeks early, it meant he was really, really small. He was only 4 pounds 7. And he actually got stuck in the birthing canal because he wasn't big enough and strong enough to help himself out. As a result of that, his heart rate crashed and they had to really work very quickly in an emergency situation to get him out. They had to use forceps when they did that. And unfortunately, even though they brought him out safely, which I'll be forever grateful for, I was extensively damaged during the process. I sustained what we now call a 4th degree tear. So I was torn all the way through my vagina and my rectum, and I was stitched up in the operating theatre. Was told, you've sustained a really bad tear, but you'll be fine. Just go back on the ward with your little baby and get on with the rest of your life. As long as you keep yourself clean, you'll be fine. Unfortunately, a week later, I was found in the corridor, collapsed by a midwife, unable to walk. I was in an unbelievable amount of pain, and I was eventually examined under gas and air. That's the level of pain that I was in, because nobody could get close to me without that sort of pain relief. And they discovered that the tear had become really badly infected. I had a massive abscess. I also had a missed rectovaginal fistula. When you've got a hole between the rectum and the vagina, you've got feces actually coming out of your vagina. I was completely incontinent and I was heading right towards sepsis. So they said, right, the only way that we can get you through this is to give you a temporary colostomy. So we can divert the feces away from the wound, give everything a chance to heal. Then in 12 weeks' time, we'll reverse the stoma and you'll get on with the rest of your life. Unfortunately, the damage was too severe. And after 12 weeks, they realized that they couldn't reverse the stoma and it was going to be permanent. Ultimately, that led to me losing my job as a police officer in April 2013. And that was sort of the start of a really, really dark period for me. But ultimately, I have managed to turn my life around completely. And I'm looking forward to sharing some bits of that with you later on.
Thanks so much, Jill, for sharing your story. Paul, I understand that your experiences with IBD led you to ostomy surgery, as well as to your profession. Can you tell us more about your journey?
Yeah, thanks, Derek. Much like some of the stories you heard from Tina and Matt, I had ulcerative colitis ultimately, but my story starts about 1984 1984, actually, 1985, when I was a freshman in high school and had never been in a hospital, never seen a hospital, never thought about going into medicine in my life. And suddenly took some antibiotic erythromycin for strep throat I got over Christmas break. And a few days after that, started going to the bathroom 10, 15, 20 times a day, didn't know why, and blood started to appear. And so, of course, my parents panicked and took me to the doctor where, I underwent the wonderful tests that all of us that have IBD or other GI issues undergo. And I began to realize doctors and hospitals weren't very nice places or very nice people most of the time, at least felt like to me. And they did some really rough things to people. And so I came back to get my diagnosis, and the physician said, we're going to bring you into the hospital and you're not going to eat for the next 3 months and you're going to be hospitalized. And I said, no, the hell I am. I'm going to go play in this basketball tournament next week. And there's no way I'm not eating for the next 3 months. And he said, no, that's what's going to happen. And much like the other stories you've heard, I lost an enormous amount of weight over the next month. I went from about 158 pounds to 98 pounds in about 6 weeks, about 25, 30 kilos of weight pretty quickly, and was in the hospital for the next 6 months. And ultimately, when they tried to have me eat again, my abdomen got rigid, I got a fever, and I perforated my colon, which I didn't know at the time. And the surgeon came in. I thought he was going to tell me I couldn't eat again, but he shook me once, which was unpleasant. And he said, you're going to have surgery tomorrow morning or you're not going to live to see tomorrow night. And I think they thought I would be resistant, but I said, much like Matt said, I said, do it now, cut me now. I said, I want this out. I'm done with this. And so they took me to surgery. And then ultimately, over a few surgeries, they created a J pouch too, but it was tough. I was the first male J pouch in Chicago at that time. And we have narrow pelvises, and these are tough surgeries. They're tough surgeries in anyone, but my pouch was never great. It fistulized very quickly, and I had pouchitis all the time, and was on antibiotics consistently for the next 5 years, and finally was doing some research at the Mayo Clinic on pouchitis, actually studying new ways to treat it, because it was sort of during this period I began to realize I think someone should go into medicine that, I don't think doctors should do a very good job of taking care of people. I think they see us as jobs to be done, boxes to be checked so often, and someone should teach them to do it better. And somehow I thought that might be me. And I also thought I wanted to study things that aren't where the treatment isn't worse than the disease, because the steroids give me panic attacks and I never got better on them. And the medications seem to be worse than the illness sometimes. And so I became interested in nutrition and exercise as interventions to improve outcomes and study disease. And so was doing research at the Mayo Clinic when I ate an apple one day, got a bowel obstruction, ended up losing part of my intestine to that apple. And they looked at my pouch and said, your pouch is done. And so a few months later, I had my pouch diverted and had an ostomy created, but they left my pouch in, much like Tina described, because they said, well, your abdomen's concrete. You won't be able to have kids if we get it out now. But come a year or two later, when I was getting ready for medical school, I said, I can't live like this. I kept getting infected. I kept having drainage and having to take antibiotics. And I said, take this out. And he said, no, if you're going to do this, you're going to sign a consent with a 70% chance you won't be able to have children. You're going to need a sperm bank. You're going to need to do all these things. And so I said, that's fine. I'll do all that. But the other interesting thing was about a year before, the same surgeon was a big runner. And he said, Paul, you're getting a little chubby. And I'd never had anybody tell me that before. And so I said, I'll show him. And I started running every day for my senior year of college. And I had surgery that was supposed to take 8 hours right before medical school. And he said, this is going to be a tough surgery. We'll see if we can get it done. And I came out of the recovery room 4 hours later. And I said, gosh, did you even do the surgery? And he said, I don't know what you've done for the last year, Wischmeyer, but whatever you did, keep doing it, because your abdomen that was like a concrete scar before looks like you've never had surgery before now. And he said it probably saved the future of your married and child life. And so I haven't stopped since. And that's when it really drove home to me what key role caring for yourselves and exercise and nutrition and all the things that, we're told to do, but sort of poo-poo is that's not real medicine. It is real medicine, and it really saved my life. And, since then, that's where my research and a lot of my medical care has gone. I'm a critical care physician by practice, working now in a COVID ICU, largely in surgical ICU. But my research is in nutrition and exercise to help people get ready for surgery and recover from surgery, which is stuff a lot of us have to do every day anyway, because we all know that even though we're perhaps cured of our illnesses, or at least partially cured, the chance we'll have surgery again is real, and from obstructions or other scarring. And in fact, I was just hospitalized twice this year for obstructions and had the scopes and had the dilations I get adhesions from time to time. So I always figure I'm preparing and recovering from surgery all the time, and I just want to teach other people to do that. Because I think the amazing part here is, so many of the patients I see have ostomies every day, and they feel like their lives are over. But as you're here today, and you've already heard, there's nothing you can't do with an ostomy that you couldn't do, that you could do before, that you can't do now. You can do anything with an ostomy. And like you've heard, I ran marathons in medical school. I've been a bodybuilder, a powerlifter. There was nothing I couldn't do, I found, and it saved my life. And I think we all want that for everyone else too.
Well, thanks so much, Paul, for sharing your story. I mean, each one of you have brought a truly unique perspective from telling us these stories. Thank you. One of the common fears we have heard from people about life with an ostomy is that they won't be able to participate in the activities they love, whether it's going for a swim, going for a bike ride, jogging, or even doing contact sports. Yet your experiences and others tell us that it's really possible for people to live an active and healthy life with an ostomy, and perhaps even do things they couldn't do before they were ill. Gill, please tell us about your commitment to active living and sports. What adjustments, if any, have you made?
Yeah, well, I have been supercharged since I recovered from my stoma surgery. I think that is the only way to describe it. I had a good period of time, like I described earlier, a good 2 to 3 years when I wasn't very well and I was struggling quite a lot. But once I got my head around everything that had happened, I thought, right, that's a period of time when I couldn't do anything. So now I'm going to do everything. And I have literally done everything since. So I started doing triathlons, never done one in my life before. I had my surgery, never thought I could. And I've gone all the way up to doing a half Ironman triathlon. I have cycled 100 miles and more a couple of times. I've done a 105-mile endurance event. I've jumped, or rather I was pushed out of an aeroplane, skydiving. I've got my scuba paddy diving course. I've become quite a proficient open water swimmer, which I was terrified of doing before because I'm a child of the 1980s and I watched Jaws. So therefore, for 30 years, I didn't really go in the sea. But I've conquered that to the extent that, like you mentioned before, I've actually signed up to swim the English Channel in 2023. So yeah, I am very, very committed to having an active life. The adjustments that I make have certainly changed over the years since having my stoma, and that's got a lot to do with confidence. So at the beginning, for example, when I went swimming, I would put extra barrier tape around. I would even wear a special swimming costume that I could fit my pouch into. I don't do anything like that now. I just put on a swimming costume and off I go. If I go for a long cycle ride, I basically just make sure that I don't eat anything that my body might, have a funny reaction to. If you're out and about in the middle of nowhere and you don't necessarily have access to toilet facilities, and there might not be good tree cover, I just make sure I stick to porridge and things like that I know that I'm not going to get a bad reaction to. And yeah, for the skydiving, I just had to go along a little bit earlier to check if the harness was going to affect the pouch and affect my stoma. But that was really the only adjustment that I had to do, compared to my friends that I did it with. But yeah, I'm very committed, and I'm very committed to getting other people to be active with their stomas as well. So yeah, I hope people embrace it.
Thanks so much, Jill. It's just some amazing activities you've been doing. Matt, you also live an active life, playing cricket and rugby. Do you have any short stories that you'd like to share?
I've got loads of stories, Tarek, absolutely loads of them. So just before I had surgery, one of the main things for me was I going to be able to play sport again, specifically rugby, because rugby is integral to my life. It's been a part of my life since I was really young, and I love it. My surgeon said he had never heard of anyone playing rugby with a stoma at all, which was the worst thing about having surgery for me. It was the only thing I cried about at all, was the fact that I wouldn't play rugby again. Everything else was fine, but not playing rugby, that hit me hard. In the next 6-month period, I actually started seeing a guy posting online about the fact that he was playing rugby. So I reached out to him and messaged him and said, how do you do this? How do you get about it? And he gave me a few tips, barrier rings and support belts and things like that. But I was still really nervous about it. And it actually took a night of madness, really. I went out after work and I had far too many drinks. I ended up at a really dingy takeaway shop, one of the cheap ones that you don't go into when you've not had a few too many drinks. And an email came through from the rugby club saying, we need a player. We need a fly half for tomorrow. Is anyone available? I was in no state to be saying yes to anything, but I agreed. So I went home, went to sleep, and woke up the next morning with the worst hangover of my life and a massive feeling of regret. Why am I doing this? This is the wrong day to be doing anything like this. But I'd committed, so along I went. I made a few adjustments. I stuck a support belt on, and off I went out onto the pitch against one of our local rivals, actually. We lost. I had an all right game, scored a try, and that's all that mattered. It was amazing. I was back on the pitch again, and I've not looked back since then. I've played loads of rugby since then. Another story is cricket related, and it was one of my first games back after having surgery. I was wicket keeping, so in baseball, it'd be the person who catches the ball when the pitcher throws it. I was doing that. Ball bounced right in front of me after the bowler had bowled it and popped up and hit me square in the bag. There was fecal matter in the bag at the time, and pop, explosion. Now, I don't know how much you guys know about cricket, but we wear whites. We wear white tops and we wear white trousers. So feces everywhere, all over. I mean, at the time it was not funny, but now it's hilarious looking back on it. It was such a silly thing. Luckily, I was only playing about 5 minutes from home, so I cleaned myself up as best I could, went home, got a spare set of kit, back out onto the pitch about half an hour later, no dramas. And another time, a very similar thing happened. I got hit directly in the stoma itself by a ball, by a cricket ball. Cricket balls are 5.5 ounces of cork and leather wrap. It's quite a heavy thing. Now, I don't know if you've ever been hit in the private parts, gentlemen. That's the feeling you get when you get in the stoma, because there's no nerve endings in the stoma, but it goes deep into your gut, and that's where you get the feeling. Not ideal, but it was fine. A friend of mine was stood next to me. When did you just get hit in the stoma? I was like, mate, that was the worst pain. But it wasn't stoma related. It was inside. Sort of traveled up my gut until it found something that wanted to feel it. So yeah, just a couple of stories. I've got plenty more that I could tell, but I don't want to take up too much of everyone's time. But yeah, no, there you go.
Certainly. Thank you, Matt. Certainly some great, examples of living an active life with an ostomy. Paul, you've talked about the impact that activity and nutrition has had on helping improve your health, especially in the earlier days. Can you share more with us?
Yeah. I think, like I said, it really started for me with that surgery at the Mayo Clinic, where I had a surgeon sort of inspire me, and it's interesting, he's still practicing today, to start running in college. And then, it really, it hit home so much, and how it to some degree saved my life and many of the important things in my life, that it just astounded me, and it became an integral part of my life. Some folks that I've talked to over there just say, do you do it because you're afraid of what will happen if you don't? And I said, well, maybe part of me is. But the reality is, we've learned a lot about what rehabilitation and optimization of patients, even very elderly patients, can do to improve their chances of recovery and function after surgery. And so we do research studies now where we train patients like athletes. We do particular exercise testing like an Olympic athlete, and we target their training, even in 70 and 80-year-olds, to heart rate goals like an Olympic athlete would. We do this very advanced cardiopulmonary exercise testing. We give them heart rate targets that they can either do in a training class before surgery or at home. Even we have Apple iPhones and iWatches, and physical therapists interact with them at home for some of our research, especially in COVID-19. But for me personally, I quickly realized, like so many have, that you're going to have surgery again. And so I always tell my patients or my trainees that every day of my life is preparing or recovering from surgery. My last major surgeries were in 2014. I had 3, and again, lost 20 kilos in 17 days, 40 pounds. And it took 2 years of exercise, and I take about 15 different supplements based on science, and eat about 4,000 to 5,000 calories a day, and, a lot of protein. It took 2 years to get it back. And this is what I do for a living. So I always feel for people who don't do this for a living and hope that we can help them do better, right? And I think some of it also is it allows you to recover quicker once you've had it, and to pursue things you love. My latest passion has been surfing, and I have to say, of all the things I've done with a stoma, surfing has been one of the most challenging, because when you pop back onto a board in a big, I like to go to Hawaii, and that's where we go a lot, and a big wave hits you and you pop onto a board, you're sliding up the board with your stoma. And so like you've heard from Matt and from all, everyone, Jill too, you get really good at pasting and taping and adjusting, but I wear board shorts and I wear, our wetsuit, and we surf in the winter here in North Carolina. Actually, the water's about 58 degrees. But wetsuits are great because they're really protective, but you can do that, right? But that's the key. If you keep yourself fit, I found, and eat well, when you do end up in the hospital, like I have twice this year, I pop right back out and I'm at work the next day, right? Hospitalizations don't take me out for days and weeks or months. They take me out for hours. I've gone back to work today. I've gotten out of hospitals with valve obstructions when I've needed to, because that's what, doing the right things with your body and taking care of yourself can do. And I really try to convey that to my patients and try to teach them there's things they can do that will make this so much better. You don't have to be a victim of this illness or a victim of having an ostomy. Really, your life is, like you heard, I think Jill said it great. And so Matt, your life really opens up when you're no longer sick. And then it's just a matter of what are you going to do with it? What adventure you're going to choose next? Where so many of us were limited by things we couldn't do before.
Thanks so much, Paul, for sharing. It's an amazing example of staying fit and leading a healthy lifestyle to just help you continuously prepare, for that possibility of having another surgery. In addition to the physical aspects of recovery from an ostomy surgery or managing ongoing symptoms of a related condition, mental and emotional aspects play a huge role as well. Tina, you've shared that your health journey has gone much further than you're feeling better physically. What are 3 challenges that you faced after having ostomy surgery?
Thank you, Tarek. I think this is such an important question on so many levels. For me, I think the emotional aspect has been huge. Like, even though I might start feeling better physically, with the ostomy or after surgery or after, certain bouts of medications, it takes time for your mental health to catch up. And I think that's something that, is often not emphasized enough. Is, okay, I have this ileostomy now. This is truly the beginning of a new life for me. And I think, for me, culturally, and this sort of goes into the next aspect of, challenges that I faced, I would say, like, for me, what's happened is that a lot of this has been cultural too. So the psychosocial has played into the cultural aspects as well, and into the mental health aspects. All of this intersects quite a bit. For me, it was the beginning of a new life, but culturally speaking, I was told that this would be the end of my life, that this would prevent me from doing the things that I love. This would prevent me from getting married or from having somebody to love me or from being accepted by society. And I think that can't be stated enough here, because there is such a stigma around ostomies around the world. A lot of times we tend to focus on how it affects the Western world because that's who's speaking up. It took a lot for me to come out and start speaking up as a woman of South Asian descent. In South Asia, Southeast Asia, and even the Middle East, you don't talk about these things. This is extremely hidden. It brings shame upon your family to talk about these things. And we don't even we can't even wrap our heads around what that psychosocial impact will be of not being able to disclose that you have, a medical device that's helping you live your life again and making you feel whole again. For me, what that looked like is, my ostomy gave me so much life back that, on one hand, I have my family and elders saying, "Oh, Tina, this is going to be the worst decision you make ever." And on the other hand, as I'm recovering from surgery, I'm having completely different emotions about it. So I'm completely split. So that was a huge challenge for me. How was I split? I actually experienced the ostomy to be completely the opposite of what I was being told that it would be. I finally felt free of disease. I finally felt like, I could do the things that I love again, be a part of life again, see my friends and family again, go out to dinners, go to the beach, go swimming, wear a sari again. These are things I wasn't able to do with such active inflammation all over my body. So I really struggled with a lot of that. And I think the struggle became very magnified for me, Tarek, when I was dealing with the reversal to the J pouch. I actually experienced a lot of grief and separation anxiety during that time. This stoma became like my baby. It was something that I took care of over those few months that I had it prior, and it became a part of me. It became something that I routinely took care of, watched, and it was like this novelty almost in a way where I was like fascinated by the fact that this thing saved my life and was allowing me to gain weight again and could allow me to eat again. So I really think that we have to do a lot in terms of destigmatizing, because this is actually something that gives life back again. And I think there's so many misconceptions around this that create challenges for us in terms of accepting ourselves for who we are. And whether or not others accept us for who we are accepting ourselves. And I think that took me a long time to realize and come out of as a challenge throughout this journey.
Well, thanks, Tina, so much for sharing. I mean, with your social media, you've been able to reach out to people and women in particular across the globe to empower them, with information and knowledge. Yeah, so congratulations on all your work. Gill, you've said it took you a few years to get to a better place in your mental well-being regarding living with a stoma. Looking back now, what is the single most important piece of advice you would give to someone facing ostomy surgery?
You are right. It took me longer because I've been perfectly healthy, and then I've got a stoma. Like, what's that about? It took a long time to get my head around that. But the single piece of advice I would give is to embrace the ostomy community. There are amazing people out there with stomas, or people who just work in the stoma community. So many knowledgeable people who really do understand what you're going through. And I didn't do that at the beginning. I just kept myself to myself, struggled on, didn't know anybody. And once I did embrace that community, it became a heck of a lot easier. Sorry. That no matter what problem or issue you've got, someone can find a solution for you. And it's a really welcoming community. And it's, let's face it, it's the place where you can make a lot of poo jokes and everyone gets them. Like, we're all on the same level. And the stories that Matt was telling earlier, we can really understand that. We can relate to it all. I had a dog jump up at me and pull my bag off. That doesn't happen to people without a stoma. So I would definitely say that. But I would also say that acceptance of your stoma is absolutely vital to, living a happy life with it. It did take me longer because I was really struggling to find what was positive about this situation. what on earth was positive about having a bag of poo on my stomach? I just couldn't find the positives. But I realized that, I'd only had 7 days of being incontinent. And if I didn't have this stoma, I would have been incontinent. I'd be in adult nappies probably, and I wouldn't be able to leave the house, and I wouldn't be able to do anything. So it was the realization that actually my stoma had prevented me from having that life. And, I'd had a little brief glimpse of how horrendous that was going to be. So that was a turning point, really, when I was able to start being grateful for my stoma and being grateful for the opportunities that it had given me. Now, I'm very lucky in that I've never, ever been bitter about what's happened. I've never looked at my stoma with anger and with bitterness. And that was a real conscious decision that I made very, very early on, because my stoma is part of me and I see it every single day. And I knew that if I was going to look at my stoma with negativity every day and with bitterness, that would flavor the rest of my day, and therefore that would flavor the rest of my life. And I realized that it's not the stoma that was going to ruin my life, it was my attitude towards it. And I'm the one in control of that. So that was a very conscious decision that I made very, very early on, that I wasn't going to resent my stoma. It took me a long time to feel gratitude for it. That's a different thing. But I think people need to know that we are very, very powerful, and we do have control over how we think about things and how we approach things. And our attitude towards things really, really can, lay the foundations for what the rest of your life's going to be like. So that's something I really want people to take from this, that you are powerful and you do have more control than you think. And just embrace us as ostomy community, because we're great and we'll help you out.
Yeah. Well, thanks so much, Jill. And I mean, I love the way you show acceptance of your stoma through all of the pictures, of your activities on your social media. I couldn't have the courage to do half the things you're doing, jumping out of planes and, swimming long distances. So congratulations, Jill. Paul.
Thank you very much.
You're welcome. Paul, you've spoken about the importance of treating the whole person. How can healthcare professionals treat the whole person and not just the disease? Can you share more about that? Add any elements of your own experience that have impacted how you approach your practice today?
Yeah, like you've heard others say, I think for me, my illness and my ostomy were some of the best things that ever happened to me. And even younger years, I began to realize that, I really didn't have a lot of direction. I was good in school, like science, but I never imagined pursuing a career in medicine. Like I said, I think my dream was to be an Olympic soccer goalie, and I'm not sure that would have paid the bills. So, it really gave me a lot of direction and a lot of passion for something, and allowed me to focus on it. And like I said, a big part of that was I still, to this day, and early on in my illness, that, physicians and other caregivers, I think, aren't always keeping the care in healthcare. It's a hashtag I use a lot, and a feeling I've had for a long time. And, I often feel that, especially when I watch my residents, my registrars, my trainees, and young physicians especially, they see patients as jobs to be done, boxes to be checked, something to get done. And, it's been striking, whenever I have surgery again, and I had a couple of big surgeries in 2014, I had a bowel obstruction and spent 8 hours. And it's interesting to be sick now as a physician who, when I have surgery, the people taking care of me, I know all of them. And I'm having my own hospital, and my own nurses are caring for me usually. And it's really interesting. And the last time I had surgery, I had a couple of interesting experiences. One in particular. So now, of course, when we do pain control, we put epidurals in, and I had an epidural after my operation. And one day I was, in a hospital bathroom, you know how small they are, naked, bleeding, pooping, in tears, frustrated with my ostomy, frustrated with how much pain I still had from the surgery. This is about a week after surgery. And the pain team comes by. There's always a team of usually anesthesia folks that come by, and they check the epidural every day. They want to make sure the site looks okay. It takes about 3 minutes to do. And of course, I'm in the anesthesia department. I know all these people. I've known some of them for 15 years. And the nurse director, 3 medical students, 2 residents, and about 3 or 4 other people. So there's about 8 or 9 people come into my room and say, "Oh, can we check your epidural?" And I'm stark naked, bleeding, stooling, a mess. And I said, could you come back later? And they said, no, this won't but take a second. They piled 9 people into my bathroom. And I know all these people. And I'm naked, never felt more vulnerable in my life. Just so they can do a 1-minute press on my back and say, oh, that looks okay. We can just do it now. And I couldn't even respond to push them away or even speak back. I was so awestruck and devastated that the tears just started to pour down my face. Thankfully, my wife, who's also a hospital physician assistant and strong-willed individual, walked in while this was happening, and she lost it on them and threw them all out of the room and said, I don't ever want to see any of you ever in this room again. And you should be ashamed of yourselves. And we looked at each other afterwards and we said, gosh, every one of these people knows me. I'm a senior physician here. If this is how they treat the people they know, how do they treat the people they don't know? And my God, how bad can it really be? And how bad is it really? And this is just one of many stories. And I think one of the other things I've really watched that I see affect even my own practice, I have to say, really my illness affects how I practice is, we have an opioid epidemic without doubt in the world and in the US in particular. And that is a tragedy in the outpatient setting. But what's happened is it's spilled over into the inpatient setting. And when someone has a major surgery, say an IBD patient who's maybe been on opiates their whole life, and has a really painful surgery, as all of you described how painful it is, we give about half the dose of the little button pain meds that we used to give. And we think somehow that one size fits all and that these small doses are going to be okay. And I watch so many patients suffer tremendous pain because of this backlash against pain control that creates suffering, immense suffering I see in patients that we're not taking into account their history, their needs, or the operation they've had. It's just, we have this route way that we should just not give anyone anything and that they should just tough it out. And I can't tell you how angry it makes me and how I really drill into my residents. This is not okay. This is not how we treat people. And it really changes how I treat pain and how I teach people to treat pain. One size doesn't fit all, and we can't stop treating people's pain because of things that have happened outside of hospitals with some of the medications that have been overused and overprescribed in other settings. And so that's just one example, I think, that has really changed what I do. And then I suppose the last thing is every day almost I see patients, often with new ostomies, and like you've heard people say, so many people think their life is over. Like, I'll never get married. No one will ever like me the same way. I won't be attractive to people. I can't go on. I've had patients tell me they would rather be allowed to die than to have an ostomy surgery. Just stop caring for me and allow me to die. I can't fathom that bag at my side. And it just floors me. And I've spent hours sometimes talking through, look, this is not the case. There is nothing you could do before that you can't do in an ostomy. And your chance to be well is real. And it's funny, I often will pull my scrubs up and say, look at, I have one, and it floors them because, of course, like everyone on screen here, none of us look sick right now. And we have to look quite fit and quite, I'm a bigger person too anyway. And they just can't believe that a physician or someone who doesn't look sick has an ostomy. And so I think I have been blown away by the social media community. I only found the Instagram ostomy community and IBD community in the last year or 2, 3 years. And I've learned so much. I've had an ostomy for 35 years, had 23 surgeries, and I learned something every day from the people on Instagram and the people in the social media world. I can't say strongly enough what an amazing community is. I tell all my patients about it. I say, if you're not on Instagram, you got to get on Instagram. And if I see this, or if you're not on Twitter, if you're not on these opportunities to learn so much and see how inspiring these people are, this is a huge opportunity. And so I think, but for more than anything, I think all of us as patients really need to speak out and really need to try to tell our physicians that there are lines that they shouldn't cross and that we're human beings too. And I always say to my colleagues and to my trainees, I want you to treat every patient like that's you laying there or your mom laying there or your child laying there. Because remember that is somebody's mom, that is somebody's child, that could be you. Because I can tell you sometime in the next few months, it'll be me. And I'm going to notice how you treat me. And I hope you notice how you treat everybody, because we're not jobs to be done. There's people underneath those drapes when you're sticking that needle in their neck, and there's people underneath those drapes when you're sticking that drain in their pelvis, and it hurts. And I sedate differently because of it. I'm heavy handed with my sedation. I'm an anesthesiologist, wonderfully trained to be able to do that safely, but I try to teach my trainees to do the same. I always tell them until you've laid in the bed. I don't want to hear your critical thought about how this person is drug seeking or how this person is just complaining too much. See how it feels if it was you, and then maybe you'd understand better.
I think, Paul, you bring such a unique perspective, being a physician and also a person with a chronic health condition. And I think it's a stark reminder for healthcare professionals, to take a more respectful approach and truly consider treating the whole person and not just the disease or the problem. Yeah. So thank you, Paul. From what we've discussed today and what we continue to see, building a support network and making connections with others can be extremely helpful to recovering from an ostomy surgery and living life with a stoma. One of the most common ways we can do that is through social media, which of course has enabled us to connect with others around the world. It has its challenges as well, especially in a diverse world where people come from different cultures or may have different points of view. Tina, what has been the most helpful or rewarding parts of connecting with others through social media? What are the challenges?
Thank you so much, Tarek. I think this is such an important question, and we don't hear much about this, honestly. I think this is a very taboo thing to have, an ostomy. In many countries around the world, the stories that I've heard are you don't get a job, you don't get married, you're not socially acceptable. It's hard for you to even step out without people whispering and talking about you. And that's kind of been my reality too. I've been told, even though that I live in the US, as I was mentioning earlier, I was told by my own family, you see that boyfriend of yours? He's never going to marry you with an ostomy. He did eventually, but with a lot of pushback. In a lot of cultures, especially where arranged marriage is dominant, it's about fitness to perform. It's about, a person being healthy. And yes, that might be an ableist view in our culture, but this is what's considered customary in some other cultures, is that you have to be healthy to be married. And it was one of those things that was very jarring for me as a South Asian American woman, having one foot in both cultures, that how is it possible that I wouldn't be having an arranged marriage, but that I wouldn't be accepted for having an ostomy, for having this inflammatory bowel disease? That was very, very difficult. I was even told at times, oh no, you should not sit in prayer at temples because even women with periods are not supposed to, and this is foul and it's disgusting. I was told that, women on their periods don't enter the kitchen. With a permanent ileostomy, how could this be reality? Not to go to a temple, not to enter the kitchen and cook your own food. It's one of those things where there is a lot of stigma creating fear, when in actuality, an ostomy is very liberating and can actually give you those elements of your life back. Whether that's cooking and cleaning, whether that's being a good partner, it makes you healthier. In my experience, that's what happened. So this was a huge cultural clash for me to try to understand why I was being told certain things out of fear and stigma, when in actuality, my experience was very different. Now, with regards to sharing stories about this, I run a Facebook community for South Asians living with IBD, and we have a lot of Middle Eastern people too, and people of Far East Asian descent as well. And I think where this is getting where this gets very tricky is, we're not used to speaking about illness publicly, but in a private forum, we feel more open to do so. We can post anonymously, we can reach out to people who have ostomies and see how it's changed their life. Now, I hear many sort of comments, even from the IBD community and colorectal cancer community, who reach out to me saying, no, I don't want an ostomy. That's like the absolute last resort. And I think where I've been able to change things, and the team that I work with online that helps me run the Facebook community, is that let's change the perception around this. Let's reframe this. And we've actually helped empower others to start speaking up and sharing their stories out of the Middle East and out of Asia in general. So I think it's extremely important to take that first step, to have the courage to do so. For me to start sharing my story, in many ways, Tarek, felt like social suicide, and it was. I lost a lot of friendships. People were like, how can you do this? How can you talk about this? Oh my God, Tina. But in actuality, I've gained a whole new circle of friends and followers. And I think, to me, that's what's important, is being able to showcase to the world, hey, you don't have to be ashamed of your ostomy. You can still live a full life with an ostomy.
Well, Tina, congratulations, on all of the work that you've done addressing the stigmatism in solvent cultures, for people living with a stoma through the amazing things you've been able to do on social media. Matt, I'll pose the same question to you. What have been the most helpful or rewarding parts of connecting with others through social media, and what are the challenges that you've seen?
Yeah, so to start with, I very much took a voyeuristic view of the social media community for a long time. I sat there watching it. I was sort of looking in and seeing what was going on, very occasionally posting something if I felt the inclination to. About a year and a half ago, COVID happened. We went into lockdown. Someone online commented that there's not many men who do this sort of thing online. So I thought, you know what, this is the perfect time. It's a perfect time to set about doing it. And I did. And I've made some amazing connections, some really lovely people out there. And the interactions you have are different with every single person. Some people just click a like button. Some people will inbox you privately, asking for advice, which I never, ever, ever give. I think as someone who's not a medical professional, the worst thing in the world I could do is say, this is what I did, so that's what you should do. I just tell my story, and that's the way I'm going to continue doing it. But as I say, I've met some wonderful people, and moving to the Northeast a few months ago, I actually had the chance to meet some real life ostomates for the first time that I know of. Because obviously you never know if someone's got an ostomy, but an arranged meet up with people that I met online, really lovely people. And we just went for a walk in a country park with the dogs, and it was absolutely fantastic. And we talked about all sorts of stuff, which included obviously ostomies, because it was really exciting for all of us. But yeah, and I think it is there. Obviously, you've got to be safe online, and you don't want to just meet randoms who you don't know who they are or whatever. But it was a real experience, and being in the online community properly for about a year and a half, it's taught me a few things, and it can be really difficult on there as well. And I think the main thing for me has always been complete honesty and openness. And I've been like that in person with people. I don't shy away from things. If someone asks me a question, I generally tell them if it's the right setting to do it. And I think online, you've got to be true to yourself. You've got to tell your story, and you've got to tell it in your way, and not feel under any obligation to say or do anything that you don't want to do online. And if you're not feeling up for it, let's be honest, chronic conditions, they take it out of you, right? Even if you're in remission, your fatigue levels are going to be higher than your average person. If you're not feeling it, don't do it, because it's just another added pressure on you, thinking that you've got to post a certain amount of times every week and things like that. And yeah, if you're starting up an online business, that's what you've got to do. But actually, I'm just there to tell my story, and hopefully, I don't even want to use the word inspire, because that's not what I'm there to do. I'm just there so that people can see my story and maybe go, hey, that's kind of cool. I can do what I want as well. And that's interesting as well, because people have used the word inspirational and stuff like that. But I'm not. I'm just me, and I'm just doing me things. I've played rugby for 20 odd years. Like it's just a me thing. And I have a stoma, and I'm going to carry on playing rugby. I've been playing cricket for 20 years. Exactly the same situation. I thought it was going to stop me, realized it wasn't. And now I just crack on. You work out your ways of doing things. And yeah, if you're going to be online, be you, be true to yourself, say what you want to say, because your views aren't always going to be the same as other people's. I know I've stuck posts online within the last few months that haven't been received well by some, but have been received amazingly well by other people. And just because we all have a stoma doesn't mean we've got the same outlook on it or the same thought process on it. So just be you, people, be you.
Well, Matt, you've got a great point, that some things work for some people, but they won't necessarily work for others. But I think through your storytelling, you're able to support so many people with an ostomy. Yeah, thank you, Matt. At this time, I'd like to take us through a few questions that have just come in. These are open to any of you. So the first question that I received is, what is the biggest misconception that you've had about ostomy surgery?
So I didn't really have any misconceptions about having an ostomy surgery. I knew it was always a possibility. But then when it came round to it, it was my decision. So I never had anything. There are some out there, and there are some that are not pushed, but allowed by mainstream media and podcasters and things like that. The only people who have stomas are old people. Well, that's a lie, isn't it? If you have a stoma, you smell. Nope, not at all. In fact, probably we smell less because you can't smell when we pass wind. And that's where I'm going with it, to be honest with you. There are misconceptions out there, but I've never had them myself. And hopefully by doing this sort of thing, we can stop other people having them as well.
Yeah, thank you, Matt.
I think for me, like Matt said, when I had the surgery, I couldn't wait to have it. But I think despite that, as I got older and spent a fair bit of my adult life, at least single parts of it single, I think I always thought someone's gonna be freaked out by this. This is gonna throw somebody off the first time they see it. And I always try to be pretty honest with it, but sometimes suddenly you're in with someone and you haven't really talked about it. And I was blown away by how little people are bothered by them. I think we as ostomies are bothered by them or think we are going to be bothered by them much more than most people are. I can think of one or maybe two people who really were shocked by it the first time they saw it. And everybody else, including the amazing person I'm married to, wasn't fazed by it at all, which always, still to this day, I guess surprises me, because I always wonder if I was on the other side of it and didn't have one and suddenly was intimate or was with someone who had one, how would I react to that? And I hope I would be as unfazed by it as the people that I've met through my life. And I think that's a misconception I hear from patients all the time. I talk to a lot of kids who are thinking about having the surgery, and I tell every one of them, don't wait if you have IBD, because this disease is going to come back for you. And I think, like you said, it's like people think it's the last resort, where I often think, gosh, don't wait too long. And of course, the risk of colon cancer goes up so much through your life if you keep your colon. But they always ask me that, are boys or girls going to like me? And I always say, surprisingly, they are. And I think that's a big misconception. And then I think the other quick few is, you can't be actively athletically, which clearly everyone you've heard today clearly shows that. I often hear you can't lift heavy weights. Now, clearly, everybody's different. And if you have a hernia, if you have other incisional problems, that's one thing. But the sheer presence of an ostomy, I had a 600-pound squat and a 630-pound deadlift for part of my life. Heavy weights aren't a big thing. And you can go on to have kids. I have wonderful, amazing children, one of whom's getting ready to go to college now. And it's been interesting to see them see my stoma and see a dad with a stoma and watch how they respond to it. So I think there's many misconceptions that we even maybe sold ourselves, that I'm always shocked how people really are about things. And it's not nearly what you'd expect.
Yeah, thanks so much, Paul. I mean, you're an outstanding example of how you can, have an ostomy and pretty much do anything you want in life. Thank you.
Yeah, I think I came from, I was like a person who just came off the street and had a stoma. So I was a card holding misconception person. So I didn't even understand what the bags were. I thought it was like a catheter, that like hangs down your leg. And I thought, well, how do you walk about with this bag banging against your leg and a tube? And I just couldn't understand how it worked. And yeah, I did go through the whole thing of, oh, I'm going to get a hernia if I even turn around quickly. I was completely paranoid about all of that. But I've found that generally people are just fascinated, and they're as fascinated as I was when I got my stoma. And people in general, I find, unless they're just very polite British people, wouldn't dream of saying anything to you. But when I talk about it, and I'm very open, and I show people my bags, I don't show people my stoma because that's a step too far for me. But yeah, they're just fascinated. They want to see, well, how does what it goes on there, and how do you open the bag, and how do you take it off, and how do you have a shower? And you know, I think maybe I'm lucky in the community that I live in, but people are just interested, quite honestly. And yeah, there just is this whole lack of knowledge, of course, because if you don't have a stoma, why on earth would you know how one works? And I think this is why it's great that we've got this community of people who are trying to show people, normalize it, and not make it as scary for people, so that people who do have stomas feel more able to talk about it, and they just feel more able to be accepted, I think, really. But yeah, I had loads of misconceptions. I thought my life was over, but it had only just begun.
No, thanks so much, Jill. I mean, it's a great example about how you can do anything you want in life, but also leads into a little bit about the second question and the final question that we've received. It's, why do you think it's important to advocate for the community?
I would love to take that one, if that's okay. I think advocacy is incredibly important. And I hear this all the time, and I'm so thankful that, you know, I was an adult when I got my ostomy, but in all over the US and even in other countries, I've heard of children with ostomies being bullied. This really does need recognition on a grander scale, you know, for us to say, hey, look, there's a chunk of the population that has these, and there's nothing to be ashamed about. Equipping our children, posterity, with the knowledge to, you know, feel comfortable with their ostomies. You know, I have seen, you know, and I hate to bring up anything negative, but there was a suicide, I think, a couple of years ago by a young child in the US. That's unacceptable. And this is happening around the world all the time with ostomies, and we don't even hear about it. This is why we need as much advocacy possible so that people don't feel so ashamed. The other thing is access. So one of the things in the US is a lot of our insurance companies will cover ostomy supplies in, you know, up to a certain limit, or, you know, what have you, depending on the plan. But in you know, countries like Malaysia or India or Pakistan, people can't afford their ostomy supplies. And during the COVID pandemic, they're not even sure if they're going to get enough ostomy supplies. Their skin is getting destroyed. I've heard of stories from husbands whose wives have left them in a bathroom covered in newspapers because they don't have ostomy supplies. I hate to bring these things up, but at the same time, these things need to be talked about, because this is the reality of the world that we live in. We need to accept one another for who we are. We need to create that access for people who don't have access to the supplies that we might have. And that's why I do this work.
No, thank you, Tina. And certainly through all the work that you've done with social media, you know, you bring a completely different perspective, because now not only are we able to see what's going on, let's say in North America, but in parts of the world that, you know, we never would have imagined, you know, hearing of conditions before. So thank you, Tina.
Yeah, I'd just like to jump on there, actually, and because you probably don't know, Tina, but I've also just been doing quite a lot of work with a foundation called Beyond Fistula, and they help girls in Kenya who've got fistulas and to sort their life out afterwards. And again, these girls end up with stoma, some of them, completely ostracized from their communities, and they don't have stoma supplies either. So we've been gathering bags out to send out to them. You know, some of them haven't been able to go to school, you know, stuffing toilet roll into the stomas because they don't have bags. One girl hadn't had a shower for 10 years, the girl that I was speaking to, because she didn't want the bag to come off. So yeah, so I think, like you're saying, Tina, it's really, really important that a lot of us need to realize how lucky we are, because we are very, very, very fortunate. All of us on this panel, we're all very fortunate. Obviously, we've all had different backgrounds and different circumstances, but you know, I think it's really important that people like us who, you know, are okay, who have our ostomy supplies and have our nice lives, really, I think it's really important to use our experiences to try and help the people who don't have the opportunities and experiences that we have. So yeah, I just really love everything that Tina's about there. So I just wanted to hop on and say that I completely agree. And for me also, it's the birth trauma community, because it's a very lonely place to be when you don't know anyone in the same situation. So that's why it's important, really, for us all to share our stories, just to help other people who are struggling, really. So
Yeah, thank you so much, Jill. I think when you know, this session has been really a profound and insightful conversation and discussion. And in closing, I'd like to thank all of you again for sharing your personal stories and really for grounding us in a real perspective of the physical, the mental, and emotional aspects of living with an ostomy. The global ostomy community is an amazing group of strong and diverse individuals, and it seems the more that we're open with each other, the more voices we include in the conversation, and the more that we recognize patients as a whole, the more we can continue to do to make life better for everyone living with an ostomy. Thank you, everyone, and be well.
Thank you, Tarek.
thank you, Tarek.
Thank you.